Now, let's discuss vasculature, which is symbolized by pipes and other water-transferring devices here in Anatomy Land. Since we're in a Roman legend, Roman aqueducts symbolize major blood vessels. Like jugs on the sidelines of sporting events, the Romans used these aqueducts to keep their athletes hydrated. Let's first take a look at the silver aqueduct with the gluteal family crest. Because of their numerous victories, the Colosseum honored the gluteus family with their very own lavish, pure silver aqueduct for water. Silver represents the superior nature of this artery, so this silver gluteal aqueduct represents the superior gluteal artery, the largest branch of the internal iliac artery, and a continuation of its posterior division. It supplies the buttock's superficial muscle grouping and enters this region via the greater sciatic foramen, deep to the gluteus maximus and superior to the piriformis muscle, and then breaks into a superficial and deep branch. We'll cover this in more detail in our deep gluteal video. Notice how, before reaching the gluteus family, the aqueduct splits into two smaller branches of the same color and pattern. The first branch continues above ground and runs by general gluteus maximus as he demands his water be heated by the natural rays of the sun. This represents the superficial branch of the superior gluteal artery, which supplies the gluteus maximus muscle. The second branch dives underground and runs by medius and minimus as they prefer their water ice cold. As their biggest fan selected from the crowd, Tensi is also allowed to drink from their aqueduct. This section represents the deep branch of the superior gluteal artery, which supplies the gluteus medius, gluteus minimus, and tensor fasciae lata muscles. There's also an ivory aqueduct with the gluteal crest, providing Maximus a special ancient sports drink. The ancient ivory is said to impart strength to the liquid, and the crest prevents anyone other than Maximus from drinking from it. This represents the inferior gluteal artery, which is one of the terminal branches of the anterior division of the internal iliac artery, and also provides blood supply to the gluteus maximus muscle. Similar to the superior gluteal artery, this vessel enters the gluteal region via the greater sciatic foramen, deep to the gluteus maximus muscle, and emerges inferior to the piriformis muscle. There are also silver and ivory vases decorated with the gluteal crest lining the aqueducts, representing the superior and inferior gluteal veins. In a pinch, these vases store extra drinks for use during the heat of combat. Half hold water from the silver aqueduct, and the other half hold Maximus's special drink. The superior gluteal vein drains all four superior gluteal muscles, while the inferior gluteal vein provides additional drainage to the gluteus maximus. Let's discuss innervations. Uh-oh, storm clouds are gathering. Look, it's Jupiter, the god of thunder. I think he wants to see less cheering and more fighting. There are two nerves that innervate this muscle grouping, both originating from the sacral plexus, representing spinal levels L4 to S4. First is the inferior gluteal nerve, representing spinal levels L5 to S2. Ah! Jupiter casts an ivory lightning bolt at the feet of General Gluteus Maximus, leaving behind the cheeks of the gluteal crest. He must have a sense of humor. The color of this bolt and the crater it left behind represents that this is the inferior gluteal nerve, which innervates the gluteus maximus. The second nerve is the superior gluteal nerve, representing spinal levels L4 to S1. Now Jupiter has sent down a silver lightning bolt, burning the gluteus family logo in the dust near medius, minimus, and tensi. This represents that the superior gluteal nerve innervates the gluteus medius, gluteus minimus, and tensor fasciae lata. For clinical correlations, let's cover the injury to the superior gluteal nerve. Since that nerve innervates the gluteus medius, minimus, and tensor fasciae lata muscles, any injury to this nerve will affect these muscles and their actions. In the standing position, when a leg is raised, the contralateral gluteus medius and gluteus minimus contract, preventing the pelvis from dropping on that raised side. When the superior gluteal nerve is damaged, resulting in weakness or paralysis of the gluteus medius and gluteus minimus muscles, the pelvis will drop on the side of the raised leg. Therefore, the classic way to identify a superior gluteal nerve injury is to have the patient stand on one leg. A patient with this injury will have their pelvis descend on the unsupported side, or the side opposite of the leg on which the patient is standing. During the commotion, it looks like the gluteal family's pet flamingo has entered the Colosseum. Isn't it peaceful, standing on one leg in the crater left behind by the silver lightning bolt? This flamingo, ever the trendy bird, represents the name for the test of this injury, the positive Trendelenburg test. Okay, that's it for the buttocks or gluteal region, superficial muscle grouping. Let's review. We covered the gluteus maximus, gluteus medius, gluteus minimus, and tensor fasciae lata muscles. Arteries involved include the superior and inferior gluteal arteries, the former having two branches. The deep branch of the superior gluteal artery supplies the gluteus medius, gluteus minimus, and tensor fasciae lata, while the superficial branch supplies the gluteus maximus along with the inferior gluteal artery. In terms of veins, the superior gluteal vein drains all four muscles, and the inferior gluteal vein provides additional drainage to the gluteus maximus muscle. For innervation, the inferior gluteal nerve innervates the gluteus maximus muscle, while the superior gluteal nerve innervates the gluteus medius, gluteus minimus, and tensor fasciae lata muscles. For pathologies, an injury to the superior gluteal nerve results in a positive Trendelenburg test. All right, let's head underneath the arena to learn about the gluteal area's deep muscle grouping.